Welcome to Academic Matters. My name is Brian Goldstein, Provost and Vice President for Academic Affairs at Lasalle University in Philadelphia, Pennsylvania. My guest today is Dr. Sarah Schumann, Assistant Professor in the Department of Urban Public Health and Nutrition. Welcome, Dr. Schumann.
Thank you for having me.
Pleasure. I know this is your first year at LaSalle. Can you give us your history, how you came to LaSalle, what your background is?
Sure. I have a PhD in public health and a master's in public health. The PhD's from Temple and the master's from Arizona. I grew up here in Pennsylvania, about 4 hours north of here in pretty rural Pennsylvania. And when I was in high school, decided that I was going to be an English teacher. I love to read, and I remember being in the car on the way home from class. My dad saying, "What are you going to go to college for?" And I said, "English literature, like I'm going to be an English teacher." And he was like, "Math or science, pick one." And I studied biology at Temple and ended up liking it, but not wanting to go into med school, which is what most people were doing, and taking a few public health classes and getting really interested. And so went on to get my master's and doctorate in public health.
So even as an undergrad, how did you know to take a public health course? It does seem like people fall into it almost accidentally and then have a deep abiding love for it. So
I had a friend who was also a biology major who was going to med school but had taken a public health course and told me about it. And I said, "Oh, it sounds like a combination of health and social work, which is really what I wanted to do." And so I had taken a class and really fell in love with it.
So what's the difference in terms of the training that you go through when you get your master's in public health versus what you focused on in your doctoral work?
The master's in public health really prepared you for working in public health, so maybe working in a state health department or doing program planning and evaluation. It was not a degree that was necessarily, in my case, heavily focused on research or teaching. My doctoral program was much more focused on doing academic research and then also on pedagogy and teaching.
So maybe even before we delve more into detail about the research that you're doing and the courses that you're teaching here at LaSalle, talk a little bit about the field of public health. I would imagine there are a lot of people who don't have either a broad or deep knowledge about it. My experience as both dean and now provost is that people have some sense about it, but it's not very deep. So
no, I often get the question, is that like a nurse? Yeah. Which is a fair question, because I think that's true. A lot of people don't know what public health is. And I say, if you think about nurses or doctors or healthcare workers are taking care of individual patients and trying to get them better, public health is really thinking about how can we keep and maintain populations healthy, and if they're not healthy, how can we get them healthier? So we're talking about health prevention and health promotion as opposed to curative care usually.
So relate that to the work that you did in your doctoral program, and then talk a little bit about your research and scholarship.
Sure. Most of my work in my doctoral program was with immigrant populations, Spanish-speaking immigrant populations in Philadelphia, both in the areas of access to healthcare and diabetes prevention. That's a little bit different than the research I'm doing now, which is mostly focused on violence against women, but in my doctoral program was mostly working with making sure that immigrants had access to healthcare so they weren't getting sick, and also working with women who were pre-diabetic and making sure that they didn't develop diabetes.
What are some of the factors that keep barriers up for access to health and healthcare services, especially on the prevention side?
For people in general or immigrants?
Well, immigrants, because
okay,
in your focus. Yeah.
That's mostly what I talk about. So the major ones are money. You know, if you don't have health insurance, then it's really difficult to access healthcare services. Not knowing what services are available in the United States. If you spent the first 30 years of your life in another country, coming here and trying to figure out the US healthcare system can be really confusing. Not believing that you're allowed to get healthcare services, so believing that if I go to the hospital I might be deported or I might be denied services, are major barriers for immigrants in getting services.
I also know that in addition to your flawless English, you also speak Portuguese and Spanish. So maybe talk about how you acquired both of those languages and how you've used it both in your research and maybe even in the coursework with students.
Sure. I speak Spanish. I'd studied Spanish in high school, so I'm not a native speaker. I studied Spanish in high school and didn't stick that much. And as an undergraduate, a professor who was in the social work department, who is not my professor, her name is Rosemary Barbera, took a class to Chile, South America. She actually coincidentally works here now. Was really glad to reconnect with her when I got hired here. But she took us to Chile, and I just got really interested in the community that was there and started studying Spanish law myself, and eventually took some more courses and started volunteering. It was a lot of sort of off the books work. It wasn't a lot of coursework. Portuguese I did at Middlebury Language Schools. It was a 6-week session where it's 24 hours a day in Portuguese. But it's quite similar to Spanish, so it's sort of an easy transition.
So are you using that in your teaching or in the research that you're doing?
I'm definitely using it in the research that I'm doing. I continue to work with the Spanish-speaking immigrant population in Philadelphia, and I've been at a nonprofit called Puentes de Salud for about 6 years. That work is entirely in Spanish. Most of our patients do not speak any English or very limited English.
So talk in more detail about Puentes and the work that you're doing there, and again, how the work there relates to your scholarship, and then how maybe you integrate that into your coursework.
Yeah, sure. Puentes is a social service and health nonprofit that's based in South Philadelphia. Their target population are uninsured Spanish-speaking immigrants, although we do sometimes see uninsured patients from other regions of the world or from Philadelphia who just don't have a place to go. It has sort of 2 major areas. One is a health clinic that's open a few days a week and is run by volunteer doctors and nurses. We provide adult and some pediatric primary care for patients at a low cost, somewhere between $10 and $20. And the other big part of Puentes is the education program. And so we run an after-school program out of Southwark School, which is down in 9th and Mifflin in South Philadelphia, sort of the heart of the Mexican immigrant community, 4 days a week for elementary school children.
And what do you see as health challenges for that group that might be different from other groups that you've worked with?
The big one is just not having regular access to services. Adults, like I said, don't know where or how to get health services. They don't have enough money. Children who are born in the United States are eligible for health care, but many of them aren't registered for it. And then there are a number of children who were born in Latin America somewhere and crossed the border when they were quite young, and therefore not eligible for health care.
So you said before that your research has sort of moved into violence against women. Mm-hmm. So give us a flavor of what you're doing and how you're involving students in that work.
Definitely. I got interested in violence against women just out of having worked at Puentes de Salud in the clinic and having women sort of in casual conversation tell me I'm not sure where to go. You know, I have a friend who is being abused by her partner and I'm not sure what to recommend or where to go. I don't think there are services available. And so I turned that into a formal research project. I started doing quantitative, so doing surveys with women about intimate partner violence or domestic violence, and then also sitting down and interviewing them about violence. I've had some students help me with that work, and I have a master's public health student who's going to do her internship with me this summer down at Puentes looking at some of that stuff.
Any findings yet that you're ready to
Definitely.
share from that work?
One is that immigrants experience domestic violence at the same rate that women in the United States do, which is somewhere between 1 in every 4 and 1 in every 3 women have experienced some sort of physical, sexual, or emotional abuse in their life. But the problem is they don't know where to go to get help, or services aren't available in Spanish for them. So we're continuing to work on those things. We have a group of community health workers at the clinic, and they've been working on getting training to offer advocacy and counseling for domestic violence in Spanish, primarily around physical and sexual assault.
So I know there's often a question is when people are in that situation, why they don't just get up and leave.
Yeah.
And so maybe
I
talk
think it's
about
a really
that.
common sense question, because it makes sense. If you were being abused, why wouldn't you leave? But there's a ton of reasons why women don't leave. One, I can talk specifically about the research that I did. So one, in the case of immigrants, is I don't have anywhere. I'm afraid that I'll be deported if I report this situation. Am I allowed to call the police? If I'm not deported, would my partner be deported? You know, this is potentially the father of my children. You know, I might want him out of the house, but I don't necessarily want him in Honduras. Not having family or a support system to say, hey, if you need to get out of the house, you can come over here. If you're an immigrant here and you don't have your mom or dad or sisters or brothers here or family to help you out. It can be a really difficult situation to leave. And then often an abuser is also your financial support system, and so not having money to pay rent somewhere or put last month's down in rent and buy food and things like that.
When you talk about this kind of situation and the work that you do in class, how are undergraduates sort of reacting to that kind of discussion and public health issue?
They usually have that initial reaction that you mentioned, is why don't they just leave? So one of the things I often do is I'll put up a vignette on the board or in class and say, you know, this is Maria, she's 37, she's an immigrant, she has 2 kids who are adults, this is, you know, sort of the abuse situation, what would you recommend they do? And it's always get out of the house, change the locks on the doors, you know, throw him out, et cetera, et cetera. And then we sort of go through what are some of the larger barriers that are keeping him or her, but primarily in my case her, in that home. And they usually change their mind and have a different perspective about it and think about, one, how do we prevent this situation from even happening? So that's a big focus of public health. I mean, we certainly need to treat and help women or men who are in an abusive situation, but we want to make sure that that abuse hopefully doesn't occur in the first place.
And I would assume this is a global issue. I know you have an expertise and interest in global health. And I know you're going to Ethiopia next week, I believe. Yeah. So talk about what you'll be doing in Ethiopia as part of that.
It definitely
initiative.
is a global issue. Brother Ernest here on campus has invited me, as well as 2 colleagues from Manhattan College in New York, to travel to Ethiopia to connect with a new Lasalle school that's being built over there, but also connect with some people who are doing research in the area of gender and violence against women. We'll be meeting with USAID, we're meeting with the ambassador as well to learn about some of those issues.
Any idea yet how you're going to continue that work once you come back from Africa?
I'm open to ideas, but one of the things is I'm teaching a newly developed global health course here, both for master's students and undergraduate students at Lasalle, and we'd like to incorporate a study abroad program into that.
Great. Dr. Sarah Schumann, thank you for being on Academic Matters.
Thanks so much.
Trisha's having a sleepover tonight. Can I go?
I wonder about Lucy's friends. What should I say? I know you're only 10, but one of these days a friend will offer you a drink. And alcohol at your age can lead to so many things. None of them good.
So can I go to the sleepover?
Lucy, I want you to promise me
I
something.
finished my homework.
Bigger promise. If there's any drinking, I want you to say, "No thanks, not my thing."
Mom.
I promise you, your real friends won't care. Deal?
Sure.
Really?
I promise, Mom.
They really do hear you.
Did you pack your toothbrush?
For tips on how to start the talk, visit underagedrinking.samhsa.gov, a public service message from the Substance Abuse and Mental Health Services Administration.
It's about putting others first. It's doing your best at whatever you do. It's about being honest with yourself, with everything. It's all of these. It's more. It's commitment. This message is brought to you by the U.S. Air Force.
Welcome back to Academic Matters. I'm Brian Goldstein, Provost and Vice President for Academic Affairs at Lasalle University in Philadelphia. My next guest is Dr. Kim Lewinsky, a soon-to-be tenured Associate Professor in the Department of Education here at LaSalle. Welcome, Dr. Lewinsky. Pleasure to have you.
Thanks for having me.
So let's start with your journey to LaSalle. You're relatively new here, and so what was your path to come to 20th and Olney?
Oh, gosh. So I was one of those who always wanted to be a teacher. That was something I knew from the time I was a little girl with stuffed animals and a chalkboard on the board. And I went out, started teaching, which I absolutely loved. And it wasn't until I took a continuing studies course as a teacher, which was in literacy. And you had one of those moments where you realized how little you actually knew, even though you thought you were pretty good. So from that, it inspired me to enter a master's degree program. And while in that program, I met a professor who truly changed my life. Her name is Jane Hansen, who became a true mentor to me over the years. And something that she did differently in her class was we went in and we set goals for ourselves, as opposed to what does she want us to learn. It was, what do you want to learn? And it was a very different approach. And so I remember I said to her at the end, I said, I want to be you when I grow up. And so I said, how do I become a professor of education, particularly in literacy? And so I really kind of started to path out what that might look like, how it would look. And so a couple of years after finishing my master's, I called her and I said, I would like to come study under you. And so that's when I entered my PhD program, which is in curriculum and instruction, but my focus has always been on literacy, mainly reading and writing. And so that's what we did. And when I finished my program, LaSalle happened to have a position in the education department in literacy. And when I came here, I was immediately impressed mostly by the fact that it is such a teaching school, and that is always where my heart is. And so I knew that this was a place that truly valued teaching, and fortunately they found me interesting as well. So that's what brought me here.
So you mentioned your mentor having the students in the class do personal goals. Do you do that with the students here?
You bet I do.
I thought you might say that.
Absolutely.
And what form does that take, and how have the students reacted to that when they have to use class to write seemingly personal goals?
Yes. So in the beginning of the semester, usually I wait until we get a couple classes into it so that they start to know, what is this class all about? What am I supposed to learn? And so then they will create a goal statement for themselves. They will think about a goal that they have for themselves, a plan of action, and what evidence they plan to use to show that they've achieved that goal. And then throughout the semester, we do 3 self-evaluations. And I play with the word evaluation with the word value in the middle there. So what are you valuing most in this class? What are you learning? And so they will discuss what their goals are, what steps they've made, towards those goals. And then at the end of the semester, we do a goal presentation, which at that point, we all get to learn a little bit about what they have learned about themselves over the semester and about a particular content area, so they get to become the teachers for the rest of us.
What do you think they find the most surprising about that activity from beginning to end?
I will be honest, the hardest part is for them to set the goal for themselves, because it's very hard to see what it is that they want to learn more about, or they think, you're the one who's supposed to tell me what I'm supposed to learn. And so I do need to provide a lot of guidance and mentoring throughout the semester to get them there. But the end of the semester, especially for the goal presentations, they come in, and oftentimes I have them actually set 2 separate goals. In a literacy class, for example, they might write a personal writing goal for themselves, and then also a goal for teaching reading or writing. So we'll do a presentation, and I'll walk in, and actually we did it today in my one class, and I said, this is my favorite class of the whole semester. And they looked at me and they all said, oh, not us. They're so nervous about presenting. And then by the end of the class, they just kept clapping, and they just kept saying, this was the best class. And I said, I knew it. So they do really feel that sense of accomplishment. They know that they've achieved something that was meaningful to them, which I think is really powerful.
So I know you were a second grade teacher at one point. And so how do you use the knowledge and skills that you learned and acquired as a second grade teacher, even in a college environment?
Well, something that my mentor, Jane Hansen, taught me when I first walked into her writing class was she said, take out a piece of paper and start writing. And I said, no, you've got this wrong. I'm here to learn how to teach writing, not write myself. And I quickly learned that learning to be you must learn to write yourself in order to be a teacher of writing. And so really a lot of what I do with my students is I want them to experience what their students experience. So, you know, I try to initiate a lot of the strategies that I would hope that they would use even with second graders. It's really not that different. It's just the content that you're covering is different, or the amount of depth you get into would be different. But you know, I constantly want them to experience what their students experience. Just even sharing the goals, they said, wow, I feel like I know everyone in this class so much better than I did before. And then I said, well, why is that important? What's the importance of community? And they said, well, you know, now I'm not as nervous to raise my hand or to make a mistake. And I say, well, isn't that exactly what you'd want second graders to feel or fifth graders to feel? Or so, you know, I think when they experience it firsthand, it's a lot more, it becomes a lot more innate in them as they become teachers themselves.
So I know that you are co-directing the Writers Matters program with Dr. Robert Vogel, also a professor in the Department of Education. Talk a little bit about that program, because I think it dovetails nicely with having our own students, our college students, do reading and writing, which then we are teaching them how to do that with elementary school and older children.
So actually when I interviewed here, I met Bob on that interview, and he immediately told me about the Writers Matters program. So I knew instantly I would have a niche because I was part of a writing research team in Virginia, and so I really welcomed being a part of that here. So what it is a program that was originally set up for middle school teachers to, you know, learn about how to get kids to write. And one thing we know about research and writing is that kids write best about what they know best. And what do kids know best? Themselves. And so it's a program that helps teach teachers how to get that good writing out of students, how to help students, you know, talk about things that are important to them and express themselves. So when I came, it was originally just in the middle school program. And so I said, you know, Bob, if we have sixth graders learning how to do this, imagine what could happen if we brought it to the elementary level. So in the last couple of years, we've been piloting the program into the elementary levels with a lot of success, a lot of teachers very interested. So once a month we meet at Lasalle, and the teachers come together and share ideas with one another. A lot of my research stems from going out into their classrooms and observing what they're doing and how they're using the program in their classrooms. And something I'm really excited about that we started this past year is my juniors that I'm teaching. We've started an after-school writing program at one of the elementary schools. So part of our course is that the juniors go over to the school, and they have been teaching some of the writing lessons and writing with the students. And their final project is creating a book for other teachers that also want to start an after-school program. So it's really given them an authentic experience. They're learning so much about writing through the act of doing it as opposed to just reading about it. And the fact that they're creating this book that's actually going to be given out to other teachers is really, really empowering to them, that they're going to contribute to this program. So it's exciting.
You mentioned that you took a program that was more focused on middle school children and moving it to elementary, which begs the question, what age should we be starting this? Came across an article, I think it was in the Washington Post, that talked about one of the Norwegian countries that doesn't even start reading literacy and reading and writing, I think, till 6 or 7, and here we are doing flashcards in the crib at, 1.5. So is there an optimal age?
There was an old school mentality that, you don't teach a kid to write till they can actually write words, and it really depends on how you define writing. Take me into any preschool classroom where a child picks up a book and makes up a story as they're looking at the pictures and turning the page, and don't you dare tell them that they're not really reading. They are absolutely reading. So we learn more and more that all of those early literacy skills are so critical. So that pretend reading or pre-reading
Those are all steps. They're learning what fluency feels like, what it's like to read a book, just how to hold a book, how to turn a book, and the same goes for writing. So even if it's a 3-year-old that's putting scribbles on a paper and you say, so tell me about what you just wrote. If you think of writing as a way of communicating, we know that pictures communicate all kinds of things, and so it's the beginning stages of storytelling. And even though it looks like scribbles to you, they can tell you that that's a frog in a pond, or so it really helps them to develop that ability to start telling stories, and that's really what communication is all about.
A very complicated question in the 2 minutes that we have, which is, there's been a lot of discussion of the so-called word gap, and so I'm going to ask you to explain the word gap between children from various socioeconomic levels. And so can you talk a little bit about the word gap and what we as educators should be doing to if you believe it exists, to try to narrow that gap?
It absolutely exists. You take a student or a child who has been read to every single day for 30 minutes from the moment of birth. By the time they get to kindergarten, that's quite a number of words. That's a lot of language that's been developed. Another child who's maybe never seen a book, and they enter that same kindergarten classroom. And so often what we see is that those students are labeled as learning disabled, and what we know is that it's not. It's just lack of exposure. Those early literacy years from birth really through age 5 and 6, they are sponges for words and language. So if they're in a home where you don't have parents speaking to them on a regular basis, reading to them, using large vocabulary, all of those things, they will definitely be at a real deficit when it comes time to learning to read and write.
Dr. Kim Lewinsky, thank you very much for being on Academic Matters.
Thank you for having me.